assessment, I will be assessing the abdomen. First, I'm going to start off by looking at the abdomen, inspecting for symmetry, looking for any abnormalities such as looking at the vascularity, any striae, any scars. And I see no scars, I see no abnormal lesions noted on the abdomen. The color is the same consistency as the rest of the body. Next, I'm going to look at the umbilicus. The umbilicus is midline with the abdomen, no abnormal protrusion. Then I'm going to get level, look at the aorta, see if I see any abnormal pulsations, any peristaltic waves. Okay, and I see none noted. With males, it's typical to see with respirations the rise and the fall in the abdomen, and it is symmetric as he breathes. Okay. Next, I'm going to start out by auscultating using my stethoscope. I'm going to start in the right lower quadrant. I'm going to go in a symmetric fashion clockwise in all 4 quadrants. Bowel sounds were heard in all 4 quadrants. They were normal active. And if I was not able to auscultate, in order to say you did not hear any bowel sounds, you'd have to listen in each quadrant for a full 5 minutes to determine that there were no bowel sounds. Next, I'm going to auscultate over the aorta and then the renal arteries using the bell of my stethoscope to listen for any bruits or abnormal sounds. No bruits were heard over the aorta or the renal arteries. All right, next I'm going to start off by percussing. Tympany should be heard over all quadrants. You would hear a dullness as you move over any type of solid organ. And tympany was heard in all 4 quadrants. Next, I'm going to percuss the spleen. Okay, and the spleen is going to be between the 9th and 11th intercostal space, mid-axillary line. So I'm just going to palpate to find the 9th and 10th, the 9th through 11th intercostal space. Okay, and a dullness was heard as I percussed over the spleen. Next, I'll start off by percussing the kidneys as I have the patient sit up for me. I'm going to find the 12th rib, and I'm going to place my hand over the 12th rib. And then I'm going to use my fist and with one single blow to the back of my hand, assessing for any costovertebral, at the costovertebral angle for any tenderness. Okay. Was there any tenderness noted as I struck it? Okay. No tenderness was noted, which is a good sign. Then we'll go in the 4 quadrants again. I'm going to start by using light palpation for any tenderness, any masses, any bulging, any swelling. As I ask the patient with touch if he feels any tenderness. Okay. Is there any tenderness noted? Okay. No tenderness with light palpation. Then I'll move to deep palpation using the bimanual technique. So I'll take both of my hands and I'll use firm pressure to press down, assessing in all 4 quadrants. Again, assessing for any masses, any abnormalities. Okay, no masses, no bulges, and no swelling was noted during palpation. Okay, next I'm going to palpate the liver, the spleen, and the kidneys. I'll start out by the liver, and I'm going to find the last rib right here, and I'm going to use the hook technique, which as he inhales and exhales for me, I'm going to take my hand and I'm just going to hook slightly under, and as he holds that exhale, sometimes you'll be able to feel the liver, but as with him, I'm not able to feel any abnormalities with him, which is a good note. Okay, next I'm going to palpate the kidneys as he inhales and exhales. I'm going to take both of my hands using the duckbill method and press down and upward, assessing for any enlargement in the kidneys. Okay, and I couldn't feel anything, which is a good thing. I'm going to do the other side as well. Breathe in for me and breathe out. Okay. All right. No enlargement was felt during palpation. And then now the spleen. Okay, no tenderness noted. Okay, I wasn't able to feel any enlargement with the spleen, which is also a positive finding. With all three of these, you may or may not even be able to feel any palpation during this technique. Okay, is there anything else I can do for you? All right, that's it. Thank you.